Your child is 2 years old but yet does not speak in words. A college student has difficulty speaking with his friends, especially in a group, and he tends to repeat a lot of words that he avoids speaking in all those kind of situations. A classroom teacher has difficulty using her voice to speak in class, especially while raising her voice. For these different kinds of speech and language difficulties, who do we approach? Who is the professional that we have to consult is the question. And the speech language pathologist is the professional in question. My name is Donna and I'm a speech language pathologist and audiologist working at Prayatna. One of the common questions that a person who hears about this profession for the first time asks is, what do you do? To give you a better picture about what a speech language pathologist does is, we are health professionals. And health professionals assess what the speech and language disorder is and provide a diagnosis for that disorder. We also give treatment for that disorder. A speech language pathologist is qualified either in their bachelor's in speech language pathology and audiology, or they've done their master's in speech language pathology. Now, we don't just work with speech and language disorders. We also work with social communication disorders, cognitive communication disorders, as well as swallowing disorders. And this is not just limited to children, but we also work with adults and the older population. Now, what kind of clients come to us for consultation? Another way to put it is, what kind of disorders do we treat? Clients who have difficulty speaking sounds correctly and their speech sounds unintelligible come to us for therapy and for assessment. We also see clients who have difficulty speaking fluently, particularly when they're in their stressful situation and they start to repeat sounds or they get stuck in between the words abnormally. So those kind of clients do come to us and we provide treatment for them. Clients who also have difficulty using their voice because of voice misuse or abuse, such as in the case of professional voice users like singers, musicians, salespeople, teachers, etc., as well as those people who have medical condition like vocal cord paralysis also come to us for assessment and treatment. For those clients who have difficulty understanding others, as well as those clients who have difficulty expressing their ideas, opinions, as well as feelings also come to us for assessment. Now, in the case of children, we often see that their language development is affected and therefore they have difficulties understanding and expressing themselves. Now, for those who are adults or in the older population, the loss of language or significant language difficulties may be due to stroke, traumatic brain injury, or any kind of illness to the brain. Clients who also have difficulty using communication for social purposes, such as for greeting, requesting, communicating, commenting, or asking questions, could also be a client that we see. They have significant difficulties in using language to communicate to their listeners in particular settings. For example, when they're in school versus when they're at a party. For example, when they're in their workplace versus when they're at home. They also might have significant difficulties in following rules of conversation and storytelling. So most often we see that individuals with autism have social communication disorders. Another type of client that we see is those clients who have difficulties with swallowing. Now, swallowing disorders are particularly caused by injury or due to a surgery, and it is the side effect of that surgery. It could also be because of traumatic brain injury or stroke. We also see clients who have difficulty remembering, planning, or problem solving, which are areas of cognitive communication. So these kind of clients, especially in the case of Parkinsonism and those having Alzheimer's disease, come to us as patients for treatment in speech and language difficulties and cognitive communication as well. We also treat those clients who have severe expressive as well as communication disorders by providing them with alternative and augmentative communication systems. Now, if you see that your loved one or your friend or relative is struggling with any kind of speech, language, communication, or swallowing disorders, please contact or consult your nearest speech language pathologist.